Sometimes it can be really tough to land on the right diagnosis, right? Some things can be a little bit harder. And this tends to be true a lot of times for women, where we often will show different symptoms and signs for medical conditions. Today, we're going to talk about one specifically, ADHD. Joining me this morning to share more about that and some of the differences, of course, between genders, we have Dr. Jennifer Harnett-Adams, a clinical psychologist with HCA Health One. Thanks for being here today.
Yeah, thank you.
ADHD is something I know we hear a lot about. I feel like a lot of kids that grew up in the 90s and early aughts heard a lot about it in youth. But when we're talking about adults and women specifically, what does that even look like in an adult woman?
It can look a lot like overwhelm. I think
who among us is not overwhelmed?
Well, exactly, and that is one of the reasons it's so tricky to diagnose in women. I think classically we have the picture of a young boy who has trouble sitting still in the classroom, maybe is like up busy, kind of motoring around and doing a lot of things. But a lot of times in women and girls, ADHD can look much more like quiet, maybe not being able to focus as much. It can oftentimes even look hyper organized because she's working so hard to stay focused, to stay on track, to stay organized, that it might be the girl or the adult woman who has very complicated systems with her planner and the color coordination and rigid schedules and things like that, because she's working so hard to compensate for underlying ADHD.
So how do you even begin to diagnose this? Is this something that's coming after years of therapy or other, like we're checking off other lists? How do you land on that diagnosis?
So a lot of times women who have gone undiagnosed with ADHD can experience, a lifelong history of anxiety or depression that's just never quite been sorted out. And really it's because that underlying issue hasn't been recognized, because maybe on the surface, she's successful at work and, has a good family life and things look okay on the outside, but what we don't see, it's almost like she's like a duck who appears to be sailing across the water, but underneath her feet are going so hard to keep everything afloat.
I've heard that analogy before, that at the surface you may look very different than underneath. What about, so you talk about may have had a lifetime of anxiety or depression and then only late in life figure it out. What is the impact of that, of learning of a late diagnosis on your health, on your mental health?
Yeah, it can be sort of a range of experiences. It can look like a lot of relief, of like, oh my gosh, I finally have an answer. This is amazing. I can do something about it. It can also feel like a lot of lost time. Like, gosh, I wish I had known this when I was 12. It might have impacted how I did in high school, where I went to college, the kind of career I've had, and those kinds of things.
Well, and I guess my other thing is there a difference in how you would treat someone once you can land on that diagnosis? Is it medicinal? Is it other therapy mechanisms? Like, what do you do for that person, and how can that help them once they finally land on it?
Yeah, so like CBT can be a great strategy to help.
CBT, for those who don't know.
Sorry, cognitive behavioral therapy.
Yes.
So those kinds of strategies can help with like coping with the impact of ADHD. Executive function coaching might help a woman, be able to like streamline her, her work routines and her work processes to make that more efficient and easier to kind of keep on top of. And medical intervention can also be very helpful as well.
So it might change what you're doing.
Absolutely.
Day to day. Okay.
Absolutely. Yeah, and reaching out to your primary care doctor is a great place to start, and they can help you with finding medication or finding a psychiatrist that could help with that diagnosis. And also testing through a psychologist can be helpful to kind of piece apart the very specific ways that the ADHD might be impacting your functioning at home and at work.
And we're sitting here talking a lot about adults and how you can land on this diagnosis later. But if you do have a teenage daughter or an adolescent, like what are the things you should be looking out for? Is this something that like other siblings you might notice something and there's a shared component there, or mom struggles with this, so daughter might, maybe that doesn't matter at all?
There definitely is a genetic component. So, if one child in the family or one parent in the family is identified as having ADHD, it can be good to just sort of tuck that in the back of your mind as something that another family member might struggle with. And oftentimes moms, and sometimes dads, but are getting diagnosed with ADHD as adults because they're going through this process after their child's been identified by a teacher, and they're sitting back there watching their child go through this process of testing and accommodations at school, and they're like, wait a minute, this sounds really familiar. It sounds like something I experienced as well. And then that leads them to get help for themselves.
But would it be as similar for children struggling in class, anxious, struggling with focus, all those kind of things too? Okay. All right. Well, thanks, Doc, for coming in. We really appreciate your help today, and something for us families to keep an eye out for. We're going to take a break. We'll be right back.